The Diabetes Preventing the Preventables Forum is an annual scientific meeting which aims to bring together endocrinologists, epidemiologists, nurses, dietitians, and other diabetes care professionals to advocate the adoption of an integrated, structured diabetes care system. This is a forum in which to share best practices in preventative medicine and evidence-based chronic care, and to establish collaborations between key opinion leaders across Asia and beyond. In May 2012, the Diabetes Preventing the Preventables Forum attracted more than 100 delegates to the meeting in Hanoi, Vietnam. The participants shared their research findings, quality improvement initiatives, and technologies which incorporated both physical and psychological health outcomes, with the ultimate aim to prevent the onset and complications associated with diabetes. Here is a collection of short interviews with some of our distinguished speakers from the 2012 meeting.
It is now increasingly recognized that understanding the phenotypes of these individuals will actually help the care team in order to identify their needs and then actually offer the most appropriate solutions for these individuals. And I think that really forms one of the bases of the Joint Asia Diabetes Evaluation Program, which provide an internet-based disease management tool to allow doctors to establish their own registry.
And really this has been a very exciting area because over the last 6 or 7 years we've learned a lot about genetic factors that can actually predict who goes on to develop diabetes, as well as some of the genetic factors that can predict who is at risk of developing different diabetic complications. The challenge now is how we can apply that knowledge to clinical practice and how that may impact on clinical practice.
Epidemiology has led to changes in diabetes care and prevention. It's been necessary to have very long-term studies to understand what we call the natural history of the development of the disease and of the complications.
The problem is that we're still seeing increasing rates of diabetes, of new cases over time, and so I think we're at the point where we need to start to think about how we can employ the same sorts of strategies for prevention in addition to its prevention of the complications of diabetes.
The Healthcare Professional Network is called DNET, and that's open to all of those professionals involved in diabetes around the globe. It attracts all kinds of interdisciplinary people representing different disciplines. And the goal there is to really develop a virtual community of practice where people are focused on diabetes care and education, learn from each other, inquire, learn about new evidence, etc.
We need to become better at transferring this evidence base and adapting this and developing different kinds of programs and service delivery systems in more developing countries.
That diabetes is a risk factor for osteoporosis and for fractures, and that should be thought about in patients with diabetes and also probably in patients with osteoporosis or low bone density. Thought about the concurrent presence of diabetes is also probably important.
And finally, I put some emphasis from our perspective of our Peers for Progress program on peer support, emphasis on how peer supporters can help patients do that day-to-day management of their diabetes, and how they also can help patients link with the team of doctors and nurses and get that whole group working together systematically to improve diabetes management.
We at the Asia Diabetes Foundation believe that building a holistic healthcare community that enables patient empowerment is the key to preventing diabetes and other associated chronic diseases. We hope that you will join us for our Diabetes Preventing the Preventables 2013 Forum on May 24th to 26th in Kuala Lumpur, Malaysia. We'll see you there.